Hello, and are you ready to learn about fatigue? Are you ready to learn how to support your clients and your patients with fatigue? You know it's a growing problem. You know it's a problem that almost everybody that we see is dealing with to some extent or another. And it's super, super important that you, as a functional medicine practitioner or as a conventional medicine practitioner or as a nurse practitioner, as a doctor, chiropractor, naturopath, anything that you learn to help people with fatigue because it isn't going away. We see it a lot, and there's a lot of causes to it. And what we learned in conventional medicine to do with people that were tired was, test to see if they have anemia, test to see if their thyroid is low, right? Send them on their way. Not doesn't work that way. It doesn't work that way. So I'm Dr. Rita Regal Scalzo, and I'm here to tell you that there are other approaches. That when you use a functional medicine approach to handling people with fatigue, especially those that are diagnosed with chronic fatigue syndrome or chronic fatigue that's been going on for a long time, this is an important process for you to be involved in. This is an important thing for you to understand because it's going to affect just about everybody that comes through your door. So let's get started here on this channel. Thank you and welcome back. We are here to support you in getting results for people. If you're a practitioner, in getting to the root cause and understanding the biochemistry and understanding what's really going on for them instead of just slapping on a band. Super important stuff. And guess what? If you are some reason it's echoing on me. I don't know why, but I'm going to continue. Yay, because that's what we do here. So here's the deal. If you are dealing with people who have fatigue, which of course you are if you're a practitioner, if you yourself are listening in and you're somebody who's dealing with fatigue, it doesn't mean every single day, all day long, but it might, right? It might be that I can't get up off the couch kind of fatigue, or it may be that, oh, my brain is so foggy, I'm not doing well at work kind of fatigue. It may be I don't have time to deal with my kids or my family members or my relationships or going for hikes because you're too tired. This is a problem that needs to be solved, whether it's for you or for your clients. So let's jump in and get started. So what are some of the reasons we think about for fatigue? Other than that, let's just pop on some iron and let's just give you some thyroid hormones. Giving T4 and iron are not solutions to fatigue. And that's why you're not getting results there if that's what you're still doing. Hopefully you've gotten beyond that. We all know that mitochondria make energy, right? So we have to have good, healthy, functioning mitochondria. So these days there's a lot of mitochondrial supplement support on the market. Just buy this bottle of stuff and it's got some B vitamins and amino acids and lipoic acid, maybe CoQ10. Hey, is that a better approach? Sure, it's a better approach, yes. But is it the right approach? Well, it might work and it might work for a while, but if you don't really get to the heart of it, if you don't understand mitochondrial function, how are you going to help people? You have to understand how the mitochondria function. You have to understand how they work. You have to understand all the different things that go into making a healthy, strong mitochondria. So what are some of those things? Well, the basic core nutrients, the basic core things that a mitochondria needs to turn into ATP is glucose and oxygen. If you don't have both of those, you're not going to make energy. No ATP is coming out the other end. Then once they get into the mitochondria and they are floating around, in order for the mitochondria to go through glycolysis and the Krebs cycle, we need nutrients. So we need some of those B vitamins, especially NAD and FAD. We also need some other things like minerals like magnesium. We also need things like vitamin C and other nutrients that are critical for this function. So all that stuff has to be intact, and then we need amino acids. So it sounds like we need good digestive function, right, to get these nutrients in, especially stomach acid, perhaps, because that's what helps break down protein. So is just eating enough protein in the diet good enough to help supply the energy? No, because we have to break the protein down into amino acids. And what do we need for that? Healthy stomach acid. We need healthy pancreatic function. We need so much more than just eating protein eating glucose, eating B vitamins. We need to get it all together. We need to have it all come together. So we need a healthy microbiome. We need a healthy digestive tract. We need a healthy stomach. We need all those things in order to get nutrients into it. We'll go through more on another video, much more detail on this function. I have a webinar coming up. I'll put the link in the chat down below on the framework that I use for helping to solve chronic fatigue problems. It's coming up soon. So down and click on the link down below. Get access to it. It's absolutely free. So we need to look at fatigue in a different way. We need to look at fatigue as a systemic problem and work on it as a systemic level. If we want to get oxygen into the mitochondria, how do we get oxygen in? We have to breathe properly. We have to be breathing effectively. Right? And so most people are walking around like this. It's not going to effectively get enough oxygen in the system. You need to breathe. So teaching your clients right away to breathe properly is really important. Then we need to have the oxygen carried around to the tissues. How do we get it circulating? Well, good circulation system and all that, but we have to get it to be combined with the oxygen combined with iron, actually, to circulate around. That's why iron deficiency is considered a problem with fatigue. But the iron is important to create hemoglobin, right, to carry the oxygen around. So we need that. We need good oxygen carrying capacity in the blood. So how do we get iron in? Well, we have to have good iron-rich foods, first of all. And then we have to have good digestion. Again, it comes back to stomach acid. And we need to have good barrier function. You need to be able to have the iron broken down in the right part of the small intestine and then absorbed in the next part. It's important. This is important stuff. Okay? So one of the nutrients, I'll leave you hanging because I'll talk about this on the next video, is B6, how important B6 is to mitochondrial function because it's so important to the oxygen carrying capacity of the blood. So you see, this is more than just a little bit of a focus. Yeah, give them some iron. Now what? Can they actually make hemoglobin? Do they have enough vitamin B6 to make hemoglobin? Whoops, I gave that one away. All right? Can they get the iron into their system? That's another story. Then we have the glucose, right? Where does that come from? Well, it comes from the food. And we have so much of an epidemic of insulin resistance that sometimes it's hard to get that glucose into the cells. We have a lot of diabetes and hyperglycemia. Too much sugar in the floating around in the bloodstream and not enough in the cells. You don't get that glucose into the cells, no substrate for turning into ATP. So we need oxygen, we need glucose, oxygen, and glucose. And all of these other things that go into helping you to get more oxygen and glucose into the cell. We need good thyroid function because if the metabolic rate of the mitochondrial cells, the mitochondria, the cells is not high enough, we don't function. Any cells don't function properly, let alone the mitochondria require good thyroid function. So it's all these nutrients. There's all these other factors. And there's a lot of things that can go into somebody tired. It's not just about anemia. It's not just about thyroid function. We've got to look at this. We've got to look at this systemic-wide. We have to look at all of the different habits. We have to look at their food. We have to optimize blood sugar management. We have to optimize the digestion. And that's just a start. Down in the comments, please, if you want that link, put it in the comments and let me know in the comments. I'm going to give you a framework. Framework that I use and I've been using for years now. You see it a lot. So let's just jump out there and make a difference. So what I want you to do next is to put a note in the comments of the video, my webinar, and subscribe to the channel so you don't miss it. Invite your friends or colleagues. Let's change this world. Let's reinvent the healthcare system. Let's disrupt the healthcare system so that these are the kinds of we create a world healthy. Next time, sign up.